Welcome to the FMS lunges exercise video. So these exercises are basically a screening tool to see whether you're prone to certain injuries in the lower limb. But you can also use these exercises to realign both sides of your legs, okay? See whether you've got any inflexibility issues, any weaknesses on the sides, and you can really incorporate these exercises into your core workout. So there's multiple reasons why you want to try and achieve this exercise. So what we're going to go through is we're going to explain this exercise in the frontal view. Okay, we're going to see the worst technique, then we're going to see the pass technique, then we're going to see the perfect technique. Then we're going to show you from the side what it looks like. But if you watch and print off the FMS Word document on the website, you'll be able to follow us through. Okay. Now, with number one, what we're looking for is just being unstable. So from the front view, as you kind of go into the lunge, you might just, the upper body posture might go a bit skew-iffed and you're not able to get that knee behind the ankle. It might be coming off to the side, something like that, so you're kind of all over the place. Now, that's not the desired result, so what we're trying to achieve is the pass mark, which is still trying to get that knee in behind the Achilles there and the ankle, and the body weight might be forward, but everything's in line. Okay, so that's not a bad technique. But what we're really trying to achieve, okay, is making sure that pretend you're standing on a piece of 4x2. The 4x2 is only that wide, so both feet have got to be on the piece of 4x2, and we've got to have good upper body posture, hand behind the neck, the other hand behind the back, and making sure that the knee is going into the ankle, and we're not moving from side to side, and our upper body posture is completely upright. So if you can do that exercise correctly, we clearly have got to do the other side as well. So make sure you assess both. Now from the side position, so we go back into number one, and from the side, you know, they won't match up again. They'll be off to the side, maybe over this side, the body angle goes away or towards, okay, and we were too far forward. Number two is the pass mark. We can get both feet pretty straight, and the knee does go in behind the ankle, but we're just leaning too far forward. But what we're really trying to achieve is you need to pretend you're standing on that piece of 4x2, both feet aligned, back nice and straight, we're not twisting. The knee comes in behind the ankle perfectly, and everything's straight, and that this front knee will just come over the toes. Alright, and then obviously we will assess the other side. So one side will actually feel more difficult than the other side. So if this side that we're assessing kind of feels quite comfortable with that, but the other side feels very unbalanced, you really can't do it, then that's the weak side. So then therefore you would basically practice that one until it becomes level with the other side. Now that might take you a couple of hours to a couple of days to get that side right, but it's super important that you start on level one, get it to level two, and then eventually get it to level three. And then once you've got them both sides to level three, you just do them a couple of times in the week just to make sure that they stay at level 3. If you kind of leave it too long, 10 to 14 days, then you might have lost that strength that you've just gained and you'll have to do it all again. So it's just a bit of a regular exercise, this one. You should be able to do 5 lunges at technique 3 on both sides quite easily. So just work hard until you get to that point. Might take you a couple of days, might take you a couple of weeks, but just keep persevering with that one. Alright, thanks for watching.